This video presentation is about the public health effects of expanding direct-to-consumer alcohol delivery policies, with evidence from 18 states of increases in alcohol use and consequences. This study was a cooperative agreement done in collaboration with the Centers for Disease Control and Prevention and the Center for Health Promotion and Disease Prevention at the University of North Carolina at Chapel Hill. What I share today doesn't necessarily represent official views of the federal government. Excessive alcohol use is a problem in the United States. 1 in 6 U.S. adults reports binge drinking in the past 30 days, and among those who binge drink, 25% report consuming 8 or more drinks per binge drinking occasion. This excessive alcohol use is concerning because of the acute and chronic harms associated with excessive use. For example, acute harms associated with binge drinking include increased risk for injuries, violence, blackouts, and drunk driving. Additionally, chronic harms associated with binge drinking and excessive alcohol use include chronic diseases such as cancer and liver disease. Lastly, estimates from 2020 to 2021 indicate that 178,000 deaths per year are due to excessive alcohol use in the United States. There are a variety of proven ways to effectively reduce the acute and chronic effects of excessive alcohol use. And one of these is through the implementation of evidence-based alcohol control policies. Alcohol policies can influence alcohol use by impacting availability of and access to alcohol. For example, policies restricting the availability of alcohol can reduce alcohol-related harms. However, there have been concerns in recent years related to alcohol availability due to the advent of direct-to-consumer alcohol delivery, which allows consumers to purchase alcohol and have it delivered to their homes. Direct-to-consumer alcohol delivery can include things like shipments of wine or beer to consumers' homes, or delivery of drinks from restaurants or bars. One of the concerns with alcohol home delivery is inadequate age verification. One study from 2012 found that 45% of direct-to-consumer alcohol delivery orders placed by buyers younger than 21 were successfully received by those underage buyers, increasing access to alcohol among underage individuals. Other studies prior to the COVID-19 pandemic found that expanded availability of direct-to-consumer alcohol delivery corresponded with increased alcohol accessibility. One study in Australia found that excessive alcohol use was related to the use of on-demand home delivery, which was defined as receiving alcohol within 2 hours of placing an order. Among those people who received on-demand home delivery, 69% engaged in binge drinking and 28% consumed 11 or more drinks on the occasion for which they ordered the alcohol. These concerns about direct-to-consumer delivery existed prior to the COVID-19 pandemic. However, since the pandemic onset, policies in U.S. states have changed in such a way to increase the availability of direct-to-consumer alcohol home delivery. Many states enacted changes in policies with the intent of providing economic support to the hospitality industry and increasing ease of access to alcohol during COVID-19 mitigation practices. These changes included expanding the types of outlets and types of alcohol that were allowed to be delivered to consumers' homes. The 2 types of outlets were off-premises outlets, which include businesses such as liquor stores, grocery stores, and vineyards. These are considered off-premises outlets because people are not intended to consume the alcohol they purchase at that location. Rather, they are intended to purchase the alcohol and consume it elsewhere. There are also on-premises outlets, such as restaurants or bars, where people typically consume the alcohol on-site. After the onset of the pandemic, many states expanded from allowing only off-premises outlets to deliver alcohol to also allowing on-premises outlets to deliver. For instance, many consumers were allowed to order beers or mixed drinks from restaurants when ordering a meal, or, in some cases, to order only alcoholic drinks. Not only did the types of outlets expand after the onset of the pandemic, but policies often expanded the types of alcohol that were allowed to be delivered. For example, in some states where only wine was previously allowed to be delivered, changes allowed liquor and/or beer to be delivered to consumers as well. Overall, there was a 284% increase in the number of people living in U.S. states permitting direct-to-consumer alcohol delivery after the onset of the pandemic. This equates to 170 million more people having access to direct-to-consumer alcohol delivery after the onset of the pandemic. Indeed, studies during the early months and first year of the pandemic found that U.S. adults who used direct-to-consumer alcohol delivery during the early pandemic drank alcohol more frequently, consumed more alcohol, and had higher odds of excessive alcohol use. This existing research largely focused on the first months or first year of the pandemic. However, the effects of these policies may be longer lasting. Many policy changes that were intended to be temporary have since become permanent. It remains unclear how these changes have impacted alcohol use, including following the COVID-19 pandemic. Therefore, the purpose of this study was to examine the effects of time and direct-to-consumer alcohol policies on the use of direct-to-consumer alcohol delivery and alcohol use patterns and consequences across the extended timeframe of pre-pandemic through late pandemic. This study used a Qualtrics survey panel of adults 21 to 62 years who lived in 18 specific U.S. states and reported consuming 12 or more alcoholic drinks per year. Prior to selecting the 18 states, the research team, in collaboration with an alcohol policy advisory board, used data from the Alcohol Policy Information System and identified 4 groups of states with similar direct-to-consumer alcohol home delivery policies prior to and after the pandemic onset. The No Delivery Allowed group was a group of states that had no on- or off-premises delivery prior to or after the pandemic onset. The No Change in Delivery group allowed on- and or off-premises alcohol delivery prior to the pandemic but had no changes in delivery policies after the pandemic onset. The New Delivery group did not allow delivery prior to the pandemic, but they changed to allowing on- and or off-premises delivery after the pandemic onset. Lastly, the Expanded Delivery group allowed on- and or off-premises delivery prior to the pandemic, but then expanded their policy to allow more options, such as expanding from only off-premises to also allowing on-premises delivery, and or loosening restrictions regarding the types of alcohol permitted to be delivered. This map shows the 18 U.S. states that were selected for survey inclusion by their policy group. These states were selected with the aim of including a representative sample of U.S. residents based on socio-demographic, geographical, and other considerations. During the survey, participants were asked to report their alcohol use patterns across 4 different time periods. Pre-pandemic was defined as the year prior to the pandemic. Early pandemic was defined as during the lockdown periods of March to May 2020. Mid-pandemic was defined as between lockdowns and when vaccines became widely available. And late pandemic was defined as post-vaccines becoming widely available. Participants were shown this figure at the beginning of the survey and were reminded of these definitions and shown the figure 3 additional times throughout the survey to improve their recall. For each time period, participants were asked to report their alcohol use, including their typical drinking frequency, which was the number of days per week they consumed alcohol, and typical drinking intensity, the number of drinks that they consumed each day they drank alcohol. Drinking frequency and intensity were then combined to calculate the average number of drinks the participant consumed per week at each time period. Participants were also asked to report the number of binge drinking days per month at each time period. Participants reported the negative drinking consequences they experienced based on providing yes/no responses to 17 different items, which included items such as the social, physical, or legal consequences of drinking alcohol. All of the participants' yes responses were summed to get the total number of negative drinking consequences experienced across the entire COVID-19 pandemic period. Participants reported the typical ways that they obtained alcohol, such as buying it at a liquor store, convenience store, or supermarket, drinking it at a restaurant, brewery, or bar, or having it delivered. Participants who selected "had it delivered to me" were considered to have used direct-to-consumer alcohol delivery during that time period. They also reported the way in which they received direct-to-consumer delivery, such as using UPS or FedEx, or using delivery apps focused on alcohol or food. Lastly, participants reported their socio-demographic characteristics, and we included the state-level alcohol policy scale score as a measure of the overall restrictiveness of the alcohol policy environment for a given state. After screening out unqualified participants or participants who provided poor quality survey responses, the final sample included 5,360 people. The sample was 53% female, 75% white, and 87% non-Hispanic. These first two figures show alcohol consumption across the 4 time periods, with pre-pandemic in green, early pandemic in red, mid-pandemic in orange, and late pandemic in yellow. The left graph shows the average number of drinks per week, and the right graph shows the number of binge drinking days per month. As shown, both the average drinks consumed per week and the number of binge drinking days per month increased consistently from pre-pandemic to mid-pandemic, and then declined into the late pandemic period. Notably, despite declines into the late pandemic period, average drinks consumed per week and binge days per month were still higher in the late pandemic period compared to the pre-pandemic period. Regarding the use of direct-to-consumer alcohol delivery, 25% of participants reported using alcohol delivery during at least one of the 4 time periods, with the highest rates of use occurring during mid-pandemic. This figure shows the type of alcohol delivery that was used among participants. The most commonly used services were either a food delivery app, such as Grubhub, or an alcohol delivery app, such as Drizly. This figure shows the effects of the alcohol policies on the odds of using direct-to-consumer alcohol home delivery. The x-axis along the bottom shows the 4 different policy groups. The no delivery allowed group is in red, the no change in delivery group is yellow, new delivery is green, and expanded delivery is in blue. What we see here is that living in any of the states that allowed delivery corresponded with significantly higher odds of using direct-to-consumer alcohol delivery compared to living in a state that did not allow delivery. Specifically, this corresponded with 72% higher odds of using delivery in the no change in delivery group, 55% higher odds of using delivery among the new delivery group, and 111% higher odds of using delivery among people living in the expanded delivery group compared to people living in states from the no delivery allowed group. Additionally, living in the expanded delivery group corresponded with 36% and 22% higher odds of using direct-to-consumer alcohol delivery compared to living in states that had no change in delivery or the new delivery states, respectively. In other words, living in a state with the most permissive direct-to-consumer alcohol delivery policies corresponded with significantly higher odds of using direct-to-consumer delivery compared to all other types of states. Our next set of models examine the effects of using direct-to-consumer home delivery on average drinks per week and binge drinking days per month. We found that using direct-to-consumer alcohol delivery was associated with consuming 4.4 more drinks per week and a 33% higher rate of the number of binge drinking days per month. Importantly, we found no significant differences in the effect of using direct-to-consumer delivery on average drinks per week or binge drinking days per month across the 4 different time periods. In other words, the effect of direct-to-consumer delivery was consistent regardless of the time period. The last set of analyses examined the effects of direct-to-consumer alcohol delivery on negative drinking consequences, and there are 2 pieces to these findings. The first piece is shown in this figure, which shows the effects of using versus not using direct-to-consumer alcohol delivery on the odds of experiencing at least one negative drinking consequence, and how this effect changed based on the number of drinks that people consumed per week. The horizontal x-axis along the bottom shows the average number of drinks consumed per week, and the vertical y-axis shows the probability of experiencing at least one negative consequence. The solid teal line shows the probability for people who used direct-to-consumer alcohol home delivery, and the red dotted line shows the probability for people who did not use direct-to-consumer alcohol home delivery. Overall, we found that using direct-to-consumer alcohol home delivery increased the probability of experiencing at least one negative drinking consequence. but only for people who consumed at least 6 or more drinks per week on average. For example, among people who consumed 2 drinks per week, using direct-to-consumer delivery was associated with a 5.3% probability of experiencing at least one negative consequence, compared to a 19.7% probability among people who did not use direct-to-consumer alcohol home delivery. However, for people who consumed 6 drinks per week or more on average, the probability of experiencing at least one negative drinking consequence was higher among people who used direct-to-consumer alcohol home delivery compared to those who did not. For example, among people who consumed 10 drinks per week, using direct-to-consumer alcohol home delivery was associated with a 4.1% probability of experiencing at least one negative consequence, compared to a 0.8% probability among people who did not use direct-to-consumer alcohol home delivery. The second part of the findings, shown in this figure, are the effects of using direct-to-consumer alcohol home delivery on the number of negative drinking consequences. What we found was that, compared to people who did not use direct-to-consumer alcohol home delivery, which is shown in the red dotted line, using direct-to-consumer alcohol home delivery was associated with experiencing more negative drinking consequences, shown here in the teal line. For example, someone who used direct-to-consumer alcohol home delivery and consumed 5 drinks per week was predicted to experience a 7.3% higher relative rate of negative drinking consequences compared to someone who did not use alcohol delivery and consumed 1 drink per week. Overall, this finding suggests that using direct-to-consumer alcohol home delivery corresponded with a greater total number of negative drinking consequences compared to not using delivery. In summary, we found that the highest odds of using alcohol delivery was among adults living in U.S. states that expanded their direct-to-consumer alcohol delivery policies. Additionally, using direct-to-consumer alcohol home delivery was associated with greater average drinks per week, greater frequency of monthly binge drinking, and more negative drinking-related consequences. Overall, new and expanded policies related to direct-to-consumer alcohol delivery after the pandemic onset increased the ease of accessing alcohol in the U.S. Indeed, alcohol was not hard to access in the U.S. prior to the pandemic, with few states having restrictive policies. However, after the pandemic onset, it became even easier to access alcohol in many U.S. states, and part of this ease was related to expanded access via direct-to-consumer alcohol home delivery. We found these policy changes were associated with increased use of direct-to-consumer alcohol delivery, which corresponds with previous research. However, these policy changes are in contrast to existing evidence-based approaches for reducing excessive alcohol use and related harms that suggest reducing alcohol availability and access. This study also found that using direct-to-consumer alcohol delivery was associated with greater alcohol use and more frequent binge drinking. This is consistent with research that was conducted prior to the pandemic and during the early months of the pandemic. One notable finding of this study was that the effects of direct-to-consumer alcohol delivery on alcohol use did not change across the 4 time periods. Because the effect of using direct-to-consumer alcohol delivery did not change across the 4 time periods, this suggests that these findings were not simply attributable to temporary increases in alcohol use during the pandemic, but that they might be related to the use of direct-to-consumer alcohol delivery. This study also found that using direct-to-consumer alcohol home delivery may contribute to more negative drinking consequences. Also, these effects were worsened with increasing alcohol use. There might be ways to strengthen direct-to-consumer alcohol home delivery policies to protect health and safety. For instance, it's possible that strengthening the regulation of delivery and enforcement of those regulations may help to reduce alcohol-related harms that are facilitated by direct-to-consumer alcohol delivery. One potential approach would be to incorporate systems to help monitor direct-to-consumer alcohol delivery. This could include regulating online alcohol sales and delivery. Historically, regulations for online alcohol sales and delivery have varied widely across jurisdictions and have shown lower levels of safeguards or ways to monitor compliance than typical brick-and-mortar alcohol establishments. Part of these regulations could include responsible alcohol service training for delivery drivers, prohibiting sales to minors, and requiring age verification, such as scanning IDs upon delivery of alcohol. Lastly, it may be useful to consider approaches such as limits on the days and hours of delivery, similar to evidence-based approaches that limit the days and hours of sales of brick-and-mortar establishments. Examples such as these are potential ways that alcohol delivery policies could be strengthened to reduce their potential impact on excessive alcohol use and harms. There were some limitations of this study. Firstly, this study sample included fewer Hispanic adults and more highly educated adults than the general U.S. population. The study design was cross-sectional in nature, and we did not randomly assign policy groups, which means we can't say for certain that using direct-to-consumer alcohol delivery caused these changes in alcohol use or negative drinking consequences. There were also risks for recall biases due to the survey asking people to report about their past drinking behaviors and use of home alcohol delivery. Overall, we found that the highest levels of direct-to-consumer alcohol home delivery use occurred among individuals living in U.S. states with the least restrictive alcohol home delivery policies. Using direct-to-consumer alcohol delivery corresponded with increased alcohol use, binge drinking, and negative consequences. These findings suggest that the expansion of direct-to-consumer alcohol home delivery policies may have been associated with increases in alcohol use and related negative consequences in the sample of states included in this study. These findings can help inform future decisions about direct-to-consumer alcohol delivery policies in U.S. states. Thank you for your time. The studies referenced throughout this video are shown on the last slides.